Hi, I'm Dr. Rukhmi Bhat, hematologist and assistant professor of pediatrics at Ann and Robert H. Lurie Children's Hospital of Chicago Bleeding Disorders Program. I'm here today to talk to you about exercise and bleeding disorders. Families often ask me, should children with bleeding disorders exercise? And the answer is definitely yes. Physical activity and exercise are beneficial for everyone in maintaining a healthy lifestyle, but especially important in children with bleeding disorders. Well-developed muscles provide better joint support, better protection from wear and tear, and better recovery after joint bleeds. In addition to keeping you fit, exercise has a positive impact on psychological and emotional well-being. It can improve academic performance and boost energy levels while decreasing weight and feelings of depression and anxiety. Exercise even increases the good cholesterol called HDL. Now I will introduce my colleague, Liz Curran, physical therapist in the Bleeding Disorders Program at Lurie Children's Hospital.
Hi, I'm Liz. Keeping safe while exercising is always important, and activities need to be age-appropriate and properly supervised. If you are injured while exercising or performing any physical activity, you need to be evaluated and treated by your doctor at your hemophilia treatment center. Different exercises work on stretching and making muscles stronger to protect our major joints. So we work on the muscles that are around the joints to protect them from getting hurt, to keep the muscles strong for moving and playing, and to make sure our bodies move in the way they're supposed to. Now let's see some examples of exercises and stretches that you can do to help protect your joints and keep your muscles strong. We'll start with the foot and ankle exercises. Upper calf gastroc stretch. Stand facing the wall with both hands on the wall for support. Put one leg in front of the other. Keep your back leg straight with the heel flat on the floor and both feet pointing forward. Lean into the wall until you feel a stretch in your calf. Hold the stretch for 20 seconds. Repeat the stretch 5 times with each leg, and do this 2 times a day. Lower calf soleus stretch. Stand facing the wall with both hands on the wall for support. Put one leg in front of the other. Standing with both knees slightly bent, gently lean into the wall until you feel a stretch felt in your lower calf. Remember, both feet must be pointing forward. Hold the stretch for 20 seconds. Repeat the stretch 5 times with each leg, and do this 2 times a day. Foot plantar fascia stretch. Stand with the ball of your foot on the stair and reach for the bottom step with your heel until a stretch is felt through the arch of your foot. Hold for 20 seconds, relax, and repeat 5 times with each foot. Do this 2 times a day. Ankle pump. Lay flat on your back and relax your legs. Gently bend and straighten one ankle by pointing your toes down and then up towards your nose. Move through the full range of motion. If you feel any pain, stop and rest. Repeat 20 times with each leg. Do this 2 times a day. Standing heel raise. Stand with both feet on the ground next to each other. With your feet pointing forward, slowly rise up on your toes for both feet. Hold 5 seconds, then slowly lower back down. Repeat this 20 times. Do this 2 times a day. Standing toe raise. Stand with both feet together. Slowly rock back on your heels without swaying your body, then slowly come back to a straight standing position with your toes flat on the floor. Hold for 2 to 3 seconds and repeat this 20 times. Do this 2 times a day. One leg balance. Standing with your feet flat on the floor, practice your balance by standing on one foot. Keep your eyes open and your hands on your hips to help you balance. Try not to sway your body and use your ankle muscles to stand up tall. Hold for 10 seconds, repeat 5 times with each leg. Do this 2 times a day. Now let's move to knee and hip exercises. Back of your thigh, hamstring stretch. Lay flat on your back with both legs straight on the floor. Lift one leg up and hold onto your thigh behind your knee. Slowly straighten your knee until you feel a stretch in the back of your thigh. This is your hamstring muscle. Hold for 20 seconds and repeat 5 times with each leg. Do this 2 times a day. Hip piriformis stretch. Sit comfortably on a chair with your feet resting on the floor. Cross one ankle over the opposite thigh and place your elbow on the outside of your knee. Gently push on the outside of your knee with your elbow. Hold for 20 seconds. Repeat 5 times with each leg. Do this 2 times a day. Front of the thigh, quadriceps stretch. Lay face down on your belly. Cross your ankles and slowly bend your knees and lift your ankles towards your buttocks. Move until you feel a stretch along the front of your thigh. Hold for 20 seconds and repeat 5 times with each leg. Do this 2 times a day. Superman leg lift, prone extension. Lying flat on your stomach, tighten the muscles on the front of one of your thighs. Then lift that leg 4 to 5 inches off the floor, keeping your knee straight. Hold for 3 to 4 seconds and repeat 20 times with each leg. Do this 2 times daily. Straight knee quadriceps sets. Lay flat on your back and tighten the muscle on the top part of your thigh by pushing your knees down into the floor. Hold for 5 seconds and repeat 20 times. Do this 2 times a day. Next, we will demonstrate exercises for your trunk and back. Double knee to chest stretch. Lay flat on your back and pull both knees into your chest until you feel a comfortable stretch in your lower back. Keep your back relaxed and don't tighten up. Hold for 20 seconds and repeat 5 times. Do this 2 times a day. Bridges. Lay on your back with your knees bent and your feet flat on the surface. Slowly raise your buttocks from off the floor while keeping your feet flat on the floor. Keep your stomach tight. Hold for 10 seconds and repeat 20 times. Do this 2 times daily. Superman lift. Lay flat on your stomach with your arms stretched out in front of you. Turn your thumbs up, gently lift your chest and legs off the floor surface at the same time. You probably won't be able to lift them much, and that's okay. Keep your knees straight with your head looking down. Hold for 2 to 3 seconds and repeat 50 times. Do 2 times per day. Arm and leg lifts on hands and knees. For this exercise, get on your hands and knees. Tighten your stomach and lift your left arm straight in front of you at the same time that you kick your right leg straight back. Maintain your balance in this position. Hold for 10 seconds and then slowly go back onto your hands and knees, keeping your stomach tight. Then switch and lift your right arm straight in front of you and kick your left leg straight back. Maintain your balance in this position and hold for 10 seconds. Repeat this exercise 20 times, alternating 10 times on each side. Do this 2 times per day. The final set of exercises that we will demonstrate are for the shoulder and elbow. Airplane arms. Prone horizontal abduction with external rotation. Lay flat on your stomach with your arms straight out to the side. Lift your arms straight off the surface by squeezing your shoulder blades together. Keep your elbows straight and your thumbs pointing up. Hold for 3 seconds and repeat 20 times. Do this 2 times per day. Our last exercise is the shoulder elbow self-stretch. Find a corner of the wall and put your arms up on the wall with your pinky on the wall and your palms pointed in. Slowly slide one arm up the wall, leading with the pinky. Hold for 20 seconds, then switch arms. Repeat 5 times. Do this 2 times a day. In addition to the exercises we went through today, I encourage everyone to check out the U.S. Department of Health and Human Services website at www.health.gov/PA guidelines, which provides resources to help people improve their health through physical activity. Remember, by regularly stretching and exercising, you can preserve and maintain a healthy lifestyle and significantly reduce your risk for injury and spontaneous bleeding.